Hi, everybody. So, okay. So, this is going to be relatively informal. And first of all, kudos to all of you for hanging in there to the very end. We know that there's often this intense desire to beat the traffic, which I have determined is not possible to do any longer. But we have four wonderful folks who are here with us. We're gonna do sort of an open-ended discussion. We were thinking that because everybody here, all of your brains are probably crammed full of little details on little esoteric things for all of the panels that you attended, and we hope you did learn a lot. We wanted to sort of go up a bit to maybe the 30,000 foot level and get some thoughts. So first, I am going to ask the panelists to introduce themselves. You want to start with you, Senator Mazzal?
Good afternoon. I'm Ron Mazzal. I'm the state senator for the 10th legislative district, which is all of Island County, part of Skagit, part of Snohomish County. And I'm the ranking member, minority party, on health and long-term care.
Good afternoon, everyone. I'm Senator Annette Cleveland. I represent the 49th Legislative District, which encompasses most of central Vancouver and parts of Clark County in southwest Washington. I've served as the chair of the Senate Health and Long-Term Care Committee since 2018, and I'm so very honored to sit here with my esteemed panel members today. Thank you.
Good afternoon. I'm Angela Ramirez. I'm Deputy Chief of Staff at the U.S. Department of Health and Human Services, previously with the Biden White House and about 20 years on the House. Really excited here to be in Washington. Thank you for your hospitality and your extremely sunny weather.
Why, I will take credit for all the sunny weather. Umair Shah, Secretary of Health for the great state of Washington, and I should say for at least another 5 days. And so next week, January 15th, I will be ending my term after 4 years at the helm of the Washington State Department of Health, in honor of a lifetime. And I want to in particular just say thank you to the two senators to my right. They have been fantastic over the years and just really being authentic and really appreciating the opportunity to work together in a very, very bipartisan fashion. So just want to say thank you to you. And Angela, nice meeting you as well.
Okie doke. So let's start. How about if we start with you, Dr. Shah? Just as you indicated, new administrations at the state level, new administrations at the federal level. Let's first talk about what opportunities we see with both of the new administrations. What are your thoughts?
Yeah, thanks for that. I would say that there are a number of opportunities that we have to be thinking about. And I think the first and foremost opportunity is how do we figure out a way to bring the divide together? And I think that's an opportunity for all of us. There are so many things that we agree upon, and we oftentimes spend a majority of our energy on the things that we don't agree upon. And so when we think about, for example, mental health, opioids, the real concern around healthcare access, or the cost of prescription drugs, or the challenge of unaffordable costs when it comes to healthcare access, what's happening with veterans, what's happening in our rural communities, what's happening to really combat not just infectious diseases like avian influenza, but also recognizing chronic conditions, diabetes, heart disease, mental health concerns, cancer. There are so many things that we can unite on to work together. And then there's digital health and the real opportunity for health technology and really working together in systems to be able to really appreciate not just the work that we do, but to make sure that our people have the tools to be able to do that work. And the final is the workforce. The people that do the work. I think all of us agree that the workforce is so critical, whether it's in the healthcare system, the public health system, or in all the systems that work together with public health and healthcare delivery. We have to be supporting those people on the ground that are doing the work every single day, nights, weekends, holidays to be able to do the work that's necessary. And so I think there are tremendous opportunities for us. But the reality is that we also have fiscal challenges, and so we have to really make smart investments, which also promote cost effectiveness, efficiencies, and the ability for us to be able to do things that really allow us to work with partners that really oftentimes have so many of the solutions that we're also seeking.
Thanks. And Angela, your thoughts, given that you've been doing so much work for the good work on workforce for the federal government, how can we think about opportunities to sustain that work?
Yeah, I love it. I always think, and I'll say too, I similarly, the clock is ticking. I have until about the 20th at noon with this position. And so you were catching me at a very circumspect time, and I think about what we've accomplished with the folks in this room and beyond, from rolling out 988, protecting access to Medicaid. I could go on ad infinitum on the accomplishments. But when I think of the opportunities, I think about what are the things that we've already done that might be under threat, and in those gaps, in the spaces where we need to fill them, what do we want to fill them with? And I will piggyback off of the workforce piece. So for the last few years, I've been co-chairing the HHS Health Workforce Initiative along with the head of HRSA, Carol Johnson. And one of the things she and I would find across the country, from large cities, small towns, rural America, Indian country, everything in between, is that it's not actually a terribly partisan issue. If you go into the ER and there's a nurse there, great. If you go in and there isn't one, that's a problem. And it doesn't really matter if you're in a red, blue, or purple state. So thinking of ways to support the workforce, I actually think is an extremely nonpartisan space to be in. The other thing I'll throw out is, in particular, rural America. I think when you look at the congressional map, when you think about, again, how to turn things in that aren't partisan, I think folks, and so honored to be on a panel with elected officials, they know this better than anyone, they want to represent the people that are their neighbors and friends and folks that put them in these revered positions. And I think to the extent that we can look at some of these gaps that are going to be there because of the things that might be under threat, and then thinking of what those gaps are and how to make them nonpartisan, I think that's a lot of the exciting opportunities.
Thank you. Today, even attending this conference, I've been struck by just how much I've heard that people agree on. And I couldn't agree with Dr. Shaw more that there's so much that we can find, I think, to work on together and collaborate on as partners. And my belief is that one of those things that there's broad agreement about is the need for us to continue moving forward with healthcare reform. We have done such great work, but we have much, much more that we need to continue to accomplish. So my hope is we can keep that big picture in mind and look for those opportunities to continue making progress on healthcare transformation.
So I can't help but agree more. I mean, the reality is that we have some issues that we need to deal with, and these are not partisan issues. And the good chair of health and long-term care and I work very well together in a very nonpartisan way, working to solve. Doesn't mean we agree all the time, but what we're doing is we're looking for an answer. I think one of the things that we've got to take a moment and step back and realize how blessed we are to have what we do have here in the United States. I've got 3 public health hospital districts in my district, and they're struggling. They're struggling to get along, but I had a health issue in November, and we still don't know what the issue was, but 106-degree temperature is not good on the internal organs. And after a day at the local hospital, they took me to the University of Washington, and I don't remember a lot beyond that because for 5 days they were able to get it down to 104, packing me in ice. But when the fever broke, my liver, kidneys, pancreas had all quit. ended up having platelet transfusions, lots of liquids, because at 104 degrees, your body has a tendency to perspire quite a little bit. And after 11 days at the University of Washington, I was, they let me go. I told them it was probably a good idea. It was probably time for me to go home. They never came up with what had caused the problem. But I'll tell you what, had it not been for the doctors, the nurses, the emergency room staff, on and on and on, I would have died. Had I been in Africa or Brazil or even in China, all places that I had traveled and had this, I probably would not have survived that. We live with a pretty incredible medical system. It isn't perfect, but I think at times we've got to stop for just a minute and realize what incredible people and systems and the like that we do have. And that was really impressed on me this last month. Going forward, yeah, there are certainly some cost issues and otherwise, but I think we've got to be frank as well that sometimes we're part of the problem in government. And I remind people that 1/4 of the population in Washington State is on some sort of state-subsidized health plan, and we underpay. And if you talk to providers, they'll tell you that. When you talk to hospitals, they'll tell you that. So we're all paying for a system that is underpaying, and that's part of the issue. We need to address those things going forward.
So I have to say, we are so, so happy that you are better and that you are here. And so let's go to Angela. Angela, you talked about things that were under threat. So what are the risks associated with change in administration at the state and federal level? And what advice would you have for the folks in the room around how to respond in a productive way to the risks?
Definitely, and I'll echo the feelings. I'm glad you're feeling better. It's pretty incredible. I would say, we can't help ourselves. I'll go through our list of accomplishments, right? 988, more folks covered than ever before in our nation's history, on and on and on. So many things that I think when we turn the page, anytime we turn the page on an administration, I was on the transition team when we came into the White House, and everyone loves the sort of blank sheet of paper and the ability to start anew. But with that, it's a question of what are the accomplishments from the old page that are important, that new folks want to make sure stick around? What are the things that we've accomplished, whether it's some of the nonpartisan things we've talked about, like workforce, mental health, behavioral health, some of these other supports. But while I can go through the list, I'd love to highlight just a couple that I don't think get enough ink, maybe, to say it that way. One is cybersecurity. So increasingly, healthcare is like a tech company. I'm probably not breaking news to anyone in this room, but sometimes it surprises people when I talk to young folks who might want to go into healthcare, but they say, "Oh, I want to go into tech," and we kind of talk about how these two streams are starting to merge, which, on the one hand, incredibly exciting. Tons of opportunities in terms of telehealth and AI and all these types of things. On the other hand, especially when you're talking about a blank page and a new group of folks that are trying to build off of whatever momentum we may have while still turning a corner, there's some vulnerabilities there. And as healthcare increasingly becomes more and more like a tech company, the cyber criminals increasingly have more and more opportunities. And I'll bring it back to the second point, the thing I love to talk about, which is workforce. When we think about how we're recruiting people into healthcare, it's not just about making them great jobs. It's about what other opportunities might, person X have. And in the field of tech, if you get a comp sci degree, you can get a lot of very lucrative opportunities, including here in Seattle, of course. And so getting some of these people who maybe have this experience, it's some of the hardest jobs we have to recruit for, even internally at HHS, are some of the cyber tech jobs. So when I see these challenges as we turn this corner, I wanted to elevate that and hopefully spark some conversation here from the smart folks in this room on how we get new generations who might be inclined to do some cyber work into this space. The other thing I would say is just more broadly on workforce. I think one of the challenges we're going to have is to not just have more docs, nurses, techs, pharmacists, all of this, but more docs, nurses, techs, et cetera, who come from the communities they serve, who look like and have the shared experiences and languages and all these sorts of things of the communities they serve. I was listening to the health workforce panel earlier today, and someone in the audience, a National Health Service Corps person, talked about his experience in the program, and of course I made a beeline for him and probably talked to him for way too long. Apologies if he's still here. But was really curious what made him someone born outside of this country who has certain skills, language skills and that sort of thing, continue in this work. And I was thinking back after that conversation about one of the most impactful health exec conversations I had on recruitment was at a hospital in Queens with this executive who took me on a tour, and we went to the cafeteria, and he told me how he has more luck recruiting workforce in the cafeteria to train them to become nurses and even all the way up to physicians. He told me a couple of stories because he knows they come from the community, they live there, they know how to get to the hospital, they like the environment, they feel supported. So when I think about, there are 1,000 things under threat, I could go through them all. I feel like I'm probably going to touch on all of them in the next 7 business days that I have with this job. But the two I really want to elevate are the cybersecurity piece and the health workforce piece.
And Senator Cleveland, your thoughts?
Well, it won't come as a surprise because we've talked about it a lot today, but from a state perspective, what I worry most about is loss of federal funding potentially, and how it is that we are going to address that or respond to that here in the state. And certainly also concerned about federal subsidies for healthcare coverage that are set to expire this year, and how it is that we may need to respond as a state, dependent upon what the decisions are from the federal level.
Senator Mazzal?
Our federal budget deficit is a mess. When I look at the interest that we're paying each day on that, it is, I think of the fact that my grandchildren and their children will be working to pay off the debt that we've run up in the last 12 years. Our state, we've got a budget challenge coming up. My personal opinion is it isn't quite as bad as what has been portrayed, but we're ahead of the wave, and it's going to hurt a little bit to get where we need to go. I spent a lot of years serving on the boards of different companies, and I've been in this position before. And more often than not, the fear of the unknown is the worst part. When we get through it and look back on it, yeah, there's going to be some pain involved, but we're going to have managed through what we're facing here, and we'll be okay.
And Dr. Shah, given the position, the critical position that you've been in, going through and coming out of COVID, how do we think about the risk related to public health and core investments in foundational public health?
Yeah, since we don't have enough time to cover the next 7 hours, I think I'll keep it very brief. What I will say is that rinse and repeat. In America, we do this all the time. We have an urgency, we throw money at it, and the moment the urgency goes away, we forget about it. And so I always call public health the offensive line of a football team. I know Senator Mazzal is gonna appreciate this metaphor. He told me once about it, his football exploits, and I was really worried that he was going to take me down. I would say that we're the offensive line of the football team, but everybody focuses on the quarterback, and the quarterback is the healthcare system. The offensive line, nobody knows who number 75 is, and that is public health. And so we're blocking, we're sweating, we're doing all sorts of things, and guess what? here's where the metaphor breaks down, where if your team wins the Super Bowl, you continue to invest in the offensive line. But in public health, tuberculosis rates go down, right? We have STD rates go down. We say we don't need public health anymore, and we start moving elsewhere. And those investments go away, those rates go back up, and we rinse and repeat. We rinse and repeat. And so I'm really tired of the capacity challenges. We have capacity. You lose an epidemiologist. A month later, you can't get that epidemiologist back. They're gone. And what we do is we say, now we're going to go back and try to fill that gap by throwing money at it when you have an infectious disease or some other issue. So I'm really concerned that we have not learned the lessons. And I can go back to avian influenza, the first one, H5N1. I'm talking about what we first talked about, bird flu, and I'm talking about Ebola and Zika and all sorts of emergencies, not to mention COVID-19. We are doing the same thing over and over and over again, and we do not learn the lesson.
And so maybe in the 5 minutes we have left, each of you about 1 minute, and I'm going to start with you, Dr. Shah. So given what
I was
you just
done.
said, I know.
That was my
Wait.
drop the mic moment. Let's go
That
ahead
was
and go this way.
No. So this might be an easy question for you to answer in 1 minute. If you had a magic wand, what is the one thing that you would change about our healthcare system?
The one thing I would say is we have to stop just investing in the healthcare system. It's that prevention, wellness, and it's public health. The challenge is, how do you continue to invest in the offensive line when nobody knows your name? And that's what we need to be challenged by.
It's that graphic we always see that shows how much of your health is determined by your housing, by your socioeconomic status, by your living conditions. And it's that tiny sliver that's quote unquote traditional personal health care services. Yep, thanks. So, Angela, magic wand.
Magic wand, I'm going to be really fast. I'm going to piggyback off of this, but make it healthcare workforce. I'm going to say not just about the workforce pipeline, but about retention and advancement opportunities. The pipeline is critical, but talk about over and over again, if we keep putting more nurses, docs, et cetera, into the system and we're not supporting them when they're there, they will leave, they will find other jobs, and we will continue to go round and round. I don't have a football analogy, but round and around.
You're in Seahawks
like
country.
A football team.
Okay. Thank you. And Senator Cleveland, magic wand.
Magic wand. If I had a magic wand and I was queen for a day, I would work to make the healthcare system in our country more simple and more seamless. And I know that that's something we've done a lot of work on over the decades here in the state, but there's much more to do.
Yep. And Senator Mazzal.
I would put a tremendous amount more resources into behavioral health. I think that behavioral health, not only can we drive down the street and see it, I think that behavioral health is the crux of obesity, diabetes. Behavioral health is responsible for so many of the things that we're fighting in our society. And the biggest of them is individual self-worth. I think that outside of this room, out there on the street, I think we have a lot of people who question their self-worth. And when they question their self-worth, they begin to not pay attention to their physical health, their relationships, on and on and on. I honestly believe that is the biggest challenge we as a society face, is our behavioral health.
And I'm thinking that you're referencing behavioral health at the front end, not at the crisis end.
The start. I mean,
Right.
We've got to get ahead of this to address that, and in some cases in our elementary schools. We don't have the workforce, we don't have the facilities, we don't have any of these things, and the reality is that we're starting off with 6 and 7-year-olds with behavioral health problems that are going to end up as adults in crisis, and that's incredibly sad, and it's not exactly a great thing to end on. But if we don't start recognizing what a a crisis we have. It is the only thing I refer to as crisis, behavioral health. And that relates to substance abuse, that relates to everything. I think that we're sitting in a crisis that, even though we're talking about it more and we're recognizing it, I don't think that we've truly acknowledged what a place we are in our society.
So, behavioral health, a less complex, more easily navigable system, workforce, public health. All great things for magic wands, no doubt about it. So I think, are we about done? Where's state of reform? I don't have my, I don't,
Is this clock right?
I think
Jane,
this clock
says
is right.
53 seconds.
So I think we have, anybody want to do a question in the remaining minute or so that we have, or do you all want to?
Go home. They just want to go home.
No, double kudos for staying throughout the end. So thank you all so much, and safe travels home.